Good afternoon. Thank you for joining. We're going to get started in a few moments. Just want to give time for others who are joining us today. All right, we can get started.
Hey, Sunshine.
Hey, good afternoon, everyone. Thanks for joining us today. My name is Darnasia, and I'm a parent consultant with the Parent Information Center of Delaware. We also have Ms. Meadra here today with us, and today's presentation is on families' engagement in the early intervention process. PIC informs, educates, advocates, and supports youth and families in Delaware. PIC celebrated our 40th birthday this year. We are a nonprofit organization that provides tools for parents, caregivers, and advocates of children to secure appropriate education and related services. Our mission is to improve health and educational outcomes for children and youth by empowering them, their families, and the professionals who serve them. Our vision is for all children to fulfill their potential and to succeed in life and live productive lives. PIC supports youth, families, and professionals with prenatal, early intervention in grade school K through 12, post-high school, and also adulthood. We also support youth, families, and professionals with one-on-one consultations, learning opportunities like this one today, online resources, outreach, and also system advocacy. The objectives of this workshop is to discuss the critical role of families in the early intervention process and also using the Division of Early Childhood's recommended practices and engage in families' early intervention. As your child's parent, you know your child best. You are your child's first and greatest advocate. If you are concerned about your child's development, you could, one, talk to your doctor, ask for an evaluation, ask for a screening, ask for a referral, or make your own referral. Eligible infants and toddlers with disabilities aged birth to 3 have the right to receive early intervention supports and services. Family of these children also have the right to receive early intervention supports and services. This is so that the parent can assist in their child's development. Early intervention is about teams working together. Part C of the IDEA supports a teaming concept where parents and professionals work together. As a parent or a caregiver, your role throughout the process is crucial. If your child is assessed, you'll be asked questions about your child, including their strengths, abilities, interests, and challenges. This slide shows Delaware's early intervention system and the steps to it. Referral by a primary referral source for an evaluation and assessment. Evaluation and assessment. Determination of eligibility. Development of the Individualized Family Service Plan, also known as the IFSP. Transition planning as the child approach age 3.
And so before we get into the DEC recommended practices or the Division of Early Childhood recommended practices, wanted to just start with an overview of who the Division of Early Childhood is. It's a council, it's part of the Council for Exceptional Children, and it's an international membership organization whose work supports improving outcomes for infants and toddlers and children with disabilities from birth to 8, with disabilities and other special needs, but also provides specific supports to their families as well. There are a number of resources that are provided through the Early Childhood Technical Assistance Center, or ECTA, and there are resources at the end of this presentation, links to those resources at the end of this presentation that'll be available to you. Next slide. And so what does the DEC do for families? The DEC promotes policies and practices that support families and enhance the optimal development of young children, birth to 8, who are at risk for developmental delays and disabilities. It also provides guidance on early intervention and early childhood special education practices related to better outcomes for young children with disabilities, and their families and the personnel who serve them. So part of what we'll cover today is talking about family engagement in the early intervention process and ways that families can be engaged, but we'll also speak to that place from the practitioner and the professional perspective as well, ways that we can support families in our roles as professionals in the early intervention process. And so the DEC recommended practices focus on 8 topical areas around leadership, assessment, environment, family, instruction, interaction, teaming and collaboration, and transition. And we'll go through a few of these briefly as it relates to the family's role and engaging with families. But there are actual practices that are broken down into each of these domains. So if you were to go to the Early Childhood Technical Assistance website or the Division of Early Childhood's website, you would be able to see the recommended practices as it relates to each of these domains and supporting families and children from both the family perspective. So it includes practices and strategies and tips for families, as well as tips and practices for practitioners that serve families in early intervention. And so what's really great about the recommended practices is that the practices are observable. So we're able to see them in action. They are written in an active voice. They are not disability specific. So it doesn't matter what the child's disability or your child's disability is. They can be delivered in all settings, including natural and inclusive environments, which is really key for infants and toddlers. And the practices should be built on, but not duplicate standards for typical early childhood settings. And so if there are developmentally appropriate practices, it does not supersede that. It should be provided, they should be provided or used in a supportive capacity, not in place of. And so the practices are important because they encourage outcomes, improved outcomes for infants and toddlers. They support young children who are at risk for developmental delays and disabilities, limited to those eligible for IDEA services. And the recommended practices also support development and learning for all children. So additional information about the DEC recommended practices, and I'll refer to them as the DEC recommended practices throughout this presentation. They address all facets of systems improvement. They're evidence-based. They are family and practitioner-centered. They include practical examples and modeling that are observable practices, and include tools to measure effectiveness and outcomes. And so here is a brief or an example of a family practice guide. This is developed for practitioners and families, as I mentioned earlier. It includes effective ways to support early learning and development. It's tailored to children who have or are at risk of developmental delays or disabilities. It supports parent and family participation in inclusive settings and natural environments. And it also supports cultural, linguistic, and diversity. And so the way that this is designed here, it provides an overview at first, and then it breaks down specific tasks or strategies or tips that can be utilized as it relates to for this example, encouraging your child's participation in learning. So specific strategies and tips that families can use in order to support their child's learning. What's also great about these family guides is that you'll notice on the far right-hand side here, there's a video. There's a link to a video to show that practice in action, as well as an example here to provide a real live example as to what this looks like in practice. And then lastly, down at the bottom of the practice guides, there's a section here to measure if the practices are working or not. So how would we know if these practices are working? What should we expect to see as a family, or what do we expect to see as professionals if to know if this practice is working? And then there are direct links to the practices that are tied to this specific family practice guide. And so when we're talking about supporting the family's role in early intervention, there are many areas that we can support the family's role: preparing for the assessment and evaluation, participating in your child's IFSP meeting, and Darnasia explained briefly what the IFSP is. Preparing for transition. What are things that we can do as families to prepare for transition from Part C services, so the early intervention services and supports that you're receiving, transitioning into preschool or school age services? It's a very different environment. And so what are some things that we can do as a family to prepare for that process, but then also as practitioners or professionals helping families prepare for that process so they know what to expect in that transition as well? What records should I keep as it relates to my child's progress, as it relates to their assessments or medical records or communication logs or other records that we should keep on file? And then communicating with providers. Um, there are opportunities to communicate with the family service coordinator, with your physicians, with everyone that is a part of that team. And so what information should we be communicating? And this is not an exhaustive list. These are just some of the areas that we'll touch on in this presentation today. And so in looking at family engagement in the early intervention process, here are some steps that families can take to help prepare. Before the assessment, ask questions to learn about the process. What will team members be doing? How long will it take? What kinds of information will be gathered and how? And why is this information needed? This is all important for your role as a family to understand, or as a parent or caregiver to understand what to expect, to know what to expect, and to understand what services or what is going to happen as it relates to the assessment. How can I be involved in my child's assessment? You can suggest a place or time that would be best for you or your child. So, for example, if nap time is at 1 p.m., that may not be a good time right before nap, because your child might be tired and not willing to participate in the assessment process. And so, suggesting those times. Oftentimes, when you are in the process of scheduling an evaluation or an assessment, you'll be asked, do you have a preferred date or time? Or you'll be given suggested days or times. This is an opportunity for you to share what works best for your family as well. Make a list and be prepared to describe your child's skills, abilities, and interests, as well as their challenges with the team. Explain how your child interacts with others. How does he or she communicate or play with children on the playground or in play settings, or with their siblings? Describe any unusual behaviors that you may have noticed, and anything that seems odd or off to you, or unusual. These are things that you'll want to share during the assessment process. There's nothing that is um, too extreme. You are your child, you know your child, you are with your child most of the time. And so if you know their behaviors and their routines, and so if there's anything that seems off or that stands out to you, these are things that you want to be prepared to address with the team during the assessment process. Participate in observations with your child. You want to be an active part of this process, and you want to see the observations in real time. That's also another opportunity to ask questions. Um, Take time to read any documentation you receive from the team. Also know that you can reach out with any questions to your family service coordinator or members of the team. You can also reach out to PIC if you have questions about any documentation that you've received as well. And then keep records in a binder or location of all of your child's medical records, including assessments, evaluations, immunizations, and other related information, because that could be helpful in this process. And so additionally, be prepared to share your child's skills, abilities, and interests. Describe concerning and unusual behaviors, which we mentioned before. Assist the team in observing your child in different activities and routines. Be prepared to explain, how does your child interact with people and objects, with challenges? Are there unusual behaviors? If you're comfortable sharing, I mentioned briefly medical records, but if you're comfortable sharing that information, this is information that you want to share with them during this process as well. And from the provider's perspective, or the professionals that are working with families, it's also important that we are engaging in practices that help inclusive practices that help families engage in this process as well. So seeking input from families about their child's strengths and concerns, explaining the purpose of the assessment or the purpose of the meeting and how results will be used, scheduling times for assessments that the family feels will work best for the child and family, sharing ways that they can be involved in the assessment process. And so sometimes we'll say, you can be a part, we want you to be a part and contribute, but families may not always know what that looks like or what that is. And so, providing examples and sharing to them opportunities, what that looks like for them to be engaged in a part of the process. Using open-ended questions or interviews or checklists for encouraging the family to participate in ways that are comfortable for them. Using formal tools, interviews, and other informal methods, such as observations, to identify the child's strengths or what may be challenging for them in everyday activities. Acknowledge the family's observations about their child's behavior, skill, and development. So when families are sharing their concerns, it's important for us to acknowledge that, to acknowledge the concerns that they have, acknowledge their input, because this is important to them. If it wasn't, they wouldn't be sharing that information. And solicit the family's input on the assessment findings and engaging the family in a discussion of their priorities as we identify the next steps for supporting children. And so engaging families in the decision-making process, and it may sound like some of these are repetitive because they are. Informed decision-making can includes 3 interrelated activities. They are identifying the parent concerns and priorities, supporting resources and addressing concerns for priorities, and then the sources of the supports and resources. Parents can only make informed decisions if they are provided the opportunities to do so with complete and unbiased information. Early childhood practitioners are important sources of that information. And so providing information specifically that is responsive to the parents' concerns or priorities is key to help them to participate and engage meaningfully in the decision-making process. Working with families to identify what they want to accomplish for their child and family, engaging families in prioritizing their concerns and goals. So as mentioned on the previous slide, a checklist or some type of a tool that helps families prioritize their concerns, and we work on these goals together. Working with families to identify the types of supports and resources that might be needed to address their concerns or priorities. This can include a child rearing child care information, emotional support, parent information, parenting information, child level interventions, or any other types of supports or community resources that may be available. And oftentimes, family service coordinators are having these conversations with families or connecting them to families or resources in the community if the need arises or if parents express that interest. And so I briefly mentioned the transition process from Part C to Part B, but ways that we can engage families in this process. Talking with other families can be engaged in this process. Talk with other families whose children have transitioned from early intervention to preschool. Attend the transition planning conference and meetings. Ask questions that will help you understand the transition process and timelines. Review the parent guide or procedural safeguards provided to you and ask questions about your rights if you have questions. Share your concerns and your hopes for your child. Discuss what support you think your child may need. Visit different preschool programs in your community and learn about classroom routines, activities, and schedules. Is this something that my child will be able to do? What does this look like for my child? What is a typical day going to look like for my child? This will be really will be essential in making those informed decisions as it relates to the supports that your child will need when they transition out of early intervention into Part B services. Ask how interventions and supports are provided for your child. What does this look like? What will a typical day look like for my child? If your child is found eligible for services under IDEA, ask the school district staff how they will work with your child to address the goals in their IEP. And so here, these are just examples as it relates to that were pulled directly from the family guides from the recommended practices. And so the purpose of these guides again are just to apply the practices into real live situations. And so in this particular situation, Luis and Carla are making plans for their daughter's Lily entry into preschool. The early intervention and school district staff provide information about preschool programs in the community. The parents visit various programs, learning about classrooms and their approaches. Having visited the programs before, the IEP meeting helps them participate in discussions about the options and make informed placement decisions. During the IEP meeting, Luis and Carla discussed their preference for one of the preschool programs. Everyone agrees that this program is a setting where Lily's strengths will be acknowledged and her developmental goals will be addressed. The school district will provide services and supports there. Lily's twin sister will also be a student in this preschool. Arrangements are made for the girls to visit the preschool together while their parents talk with the staff about Lily's abilities and needs. Luis and Carla are confident that they can help Lily transition to the preschool special education services in this new program. So here's an example of what this looks like when families are engaged and can make meaningful decisions about their the supports and services that their children will receive. And this is specific to the transition process. And so when working with families, and this is across the board, the primary barrier to strained or relationships with families or not having strong relationships with families is trust. And so it's important to take the time to build relationships with families. Think of as a professional or anyone that's working with a family, put yourself in the parent's shoes. If I were looking for services, if I had a child who needed additional supports and services in school, I would want my child to have access to all the resources and supports that are available to them. And so what does this process look like? Sometimes as us as professionals, when we're operating in this space, we are for various reasons, we're going through the steps that are necessary in order to do our jobs and to make sure that we are providing the support to our children. But this can be a very overwhelming experience for families. It's a lot of information that families that are coming at families at one time. And in many instances, families are still coming to terms with their child's diagnoses or the fact that they need supports. And so, looking through a lens of just putting ourselves in the family shoes will also help when we're working with families as well. Develop and use effective and active listening skills. Show sincere empathy and concern when talking with families for their struggles, but also celebrating their accomplishments. Be aware of our own biases and remaining non-judgmental is key in working with families. Again, talking about building those trusting relationships with families, this is key. Moving beyond words, taking concrete steps to achieve family identified goals or outcomes. So we want to get beyond, we're having a conversation, we're talking about these supports, and this looks good on paper, but we actually want to move collectively as a team and as a group to ensure that these supports are in place for the child. and empowering families to learn and do for themselves by creating opportunities for them to actively engage throughout the process as well. And so here's another example of working with families. We won't go into, I won't read this one in detail just because of time, but for those of you that have the presentation, you can read through this, and you'll also have a link to the family guide that covers this particular example as well. Next slide. And so here are additional resources. I mentioned that many of the resources that are found here that we discussed here today as it relates to engaging families came from the DEC recommended practices through the Division of Early Childhood as it relates to engaging families. And those family practice guides are broken down into those domains that we saw earlier, we discussed earlier. And so some of the examples that we talked about in this presentation are there are examples there for teaming and collaboration, how families can be involved in the informed decision-making process, how families can be engaged in the transition process, which we talked about that example, how families can be part of the team. So what are some specific strategies for teaming and collaboration as it relates to engaging families in the process? And so if you have an opportunity, please take the time to look at the Early Childhood Technical Assistance Center website, specifically those family guides. It also includes, if you're a professional listening today, it also includes checklists a self-assessment checklist to assess our role as professionals when we're working with families. Are we doing these things? And so we can assess ourselves as it relates to to what extent we engage families or support families in this process. Also, additional resources can be found at the Birth to Three early intervention regional program, excuse me. That website is available here as well. There are a number of resources that are there that can support both professionals and families, and we encourage you to access those resources that are available there and share those with the families that you're working with, or if you yourself are a family, accessing those resources there for your family as well. Darnasia, I don't know if you had anything that you wanted to add. Here are some additional resources. I'm sorry. Yeah, here are some additional resources as well as it relates to the DEC recommended practices. No, you're muted.
I'm sorry. And again, we just want to let you guys know that PIC is here to help. If you have any questions, concerns, looking for assistance and/or resources, my personal email is at dscott-perkins@picofdale.org, or I can be reached at 302-999-7394, and my direct extension is 1117. And again, thank you for your time and attending this presentation. I hope this information has and will be helpful to you and your family.
We do want to open up for questions if there are any questions. If not, again, this presentation will be available as well as the recording. Thank you for participating. And as Darnasia mentioned, at any time, feel free to contact our office or reach out to Darnasia if you have questions or just looking for additional information. But thank you for joining us today.